CORFLEX. There is a reason why I'm introducing this drug. Not that I've been paid to do so, no. Not that it's a promotion nature of promoting drugs, no. I'm doing this because most of the patients we see in orthopedic clinic or even normal consultation, they have been responding well. Welcome back with my good people. Today I want to talk to someone. This is a person that is in pain. This is a person that when he or she goes for a long call in the toilet or even in the latrine, squatting is very, very difficult. Even standing up after the toilet or after going for a latrine is very, very difficult. Your knees are in pain. Your waist is in constant pain. Your shoulders, you can no longer work the way you used to work before. Even your joints of the hands are very, very difficult to flex, to stretch. They are very, very stiff. Even your back is very, very painful. You cannot even turn well when you are sleeping. You are in constant pain. This is a person that was not using a walking stick. Now is using a walking stick. There is a problem somewhere. You've taken a lot of pills. You've taken a lot of capsules. There is no change in terms of your pain. There is no change in terms of the swellings of your knee, even your hands. There is no change. Even in doing the normal course in your house, you cannot bend. You are in constant pain. You cannot wash your clothes. You cannot even cook well for your family. What about the conjugal rights of your man or your husband? You cannot do it because you are in constant pain. Your waist can no longer be the waist that it used to be. Now, I'm talking to this person because I want to provide to you a solution. You've been going for several hospitals, but now there is no change in terms of improvement. Most of the patients that comes to the hospital, they normally come because of pain. Now, you've been diagnosed with what we call osteoarthritis or even degenerative arthritis, fibromyalgia, rheumatoid arthritis. Even you have been involved in sport injuries. You got a sprain, strain, or even fracture in road accident. You got something called prolapse of intervertebral disc. You are a person whose cartilage, you've been told that you have weak cartilage, or you've been suffering from what we call chondromalacia, that is softening of the cartilage cap. You've been diagnosed of that. You've been told that you have something called fibromyalgia and even gouty arthritis or any other inflammatory joint disease. I'm talking to this person now. If you are new in this channel and you are watching this video, kindly hit the notification bell, written subscribe, turn it on for more videos like this that I will post. This is a particular person that has no peace in his life because of pain. Now, I want to introduce to you a solution. I want to talk about a drug that will help to combat this so-called osteoarthritis or degenerative arthritis or even rheumatoid arthritis. I want to introduce to you a drug called CORFLEX. CORFLEX. There is a reason why I'm introducing this drug. Not that I've been paid to do so, no. Not that it's a promotion nature of promoting drugs, no. I'm doing this because most of the patients we see in orthopedic clinic or even normal consultation, they have been responding well with this drug. Now, this drug is very important because you just take one tablet twice in a day and it's very, very affordable. So even if you are going to work, you can take it in the morning when you are going to work, and then when you come back in the evening, before you sleep and after eating, you take another one. So I love this drug because of the six combination important components in this drug that normally bring an extra power of unique combination for joint health. combating what we call osteoarthritis, rheumatoid arthritis, all those conditions that I've talked about. And we are targeting people presenting with symptoms that I've mentioned, and I will continue mentioning that you have joint pains, you have joint stiffness, you have joint swelling, you have bone pain, particularly your waist, your knee, your hand, your shoulder, your back. This is the best video for you. Now, these 6 components of this particular drug I'm introducing again called CORFLEX FORTE. Some people call it CORFLEX, some people call it CORFLEX. Maybe R is silent, depends with somebody who taught you English. Now, CORFLEX FORTE is the drug that people have been responding well into because of those 6 unique combinations that I'm going to talk about. And the important about them is that they come, each and every combination come with its own strength. I love this drug and the way patient has been responding to. Now, the secret is here, the 6 components that I'm going to talk about. Number 1, this drug contains what we call glucosamine, 500 milligrams. Most of the joint drugs, they contain glucosamine 125 or even 250 milligrams, but this one contains 500 milligrams. And the glucosamine is a precursor of glycosylated proteins and lipids. And remember, proteins and lipids are very, very helpful in your body, in our body. Proteins normally help to repair worn out tissue in our body, and that's why it has been introduced in this particular drug. Even the lipids are also helping in combating energy, storing energy, and even providing the joint health. And by doing this, it normally rebuilds the cartilage and eventually treat arthritis. And important thing about glucosamine is that it slows down the process of arthritis. Even if you have started developing what we call degenerative arthritis, now this glucosamine will really help. Take note of CORFLEX FORTE as a tablet. Number 2, it contains what we call chondroitin. 200 milligrams. Very, very important to remember. We should be able to know that chondroitin normally occurs naturally in our body, and they also provide strong health about cartilage and help in the cartilage build. In fact, chondroitin form part of the cartilage. That is very, very important for our joint. Now, when you take this drug, it has an inflammatory agent, an inflammatory effect. And when there's an inflammatory effect in any particular drug, then it significantly reduces pain. So take note of chondroitin in CORFLEX. Very, very important. Number 3, this one is very long, so take it lightly. It contains methyl sulfonylmethane. I love medicine. It's a very long thing. Damn. Now, this one also has got also anti-inflammatory and analgesic effect. If it has those 2 components, pain is going away very, very slowly. And when it does that, it helps the connective tissue to develop strength, and you can now be able to flex. The joint, particularly those presenting with stiff joints of any form of connective tissue disorder or any form of arthritis. Another important component is that it contains ascorbic acid, that is vitamin C. Very, very important. And 15 milligrams of vitamin C is present in this particular drug. And vitamin C normally help in preventing most of the diseases in our body. And in that also it contains vitamin C, the one so-called alpha tocopherol acetate, that is vitamin E. Now vitamin E, when it is combined with vitamin C, it also helps to combat diseases and also help to bring normal joint health, lubrication, and even joint strength. And it is noted that the 2 combined reduces aging of the joints, and this is very, very important in degenerative osteoarthritis. Last but not least, an important component called manganese sulfate in CORFLEX. As you can see, all these particular joints present here in this particular leaflet I'm presenting to you is very, very important in CORFLEX. Just look at it keenly. Manganese is very, very important in bone development and maintenance. That's why it has been added in this drug called CORFLEX, and this one helps also to reduce the osteoarthritic pain. So this drug is very, very important for all those people presenting with osteoarthritis. So do not forget about this particular drug, and we are thanking Signature Healthcare in combination with Carol Laboratory Limited in bringing this particular drug. Signature has very, very many drugs that are helping Kenyans. L-Sign kit combating those who have been diagnosed with Helicobacter pylori or even sign case. And if you want the syrup that is now rocking in town when you have peptic ulcer disease, watch it here. It's called pep gel syrup. Very, very important. Thank you so much for staying watching this video, and put CORFLEX or CORFLEX in your mind. And if somebody is suffering from all those things I've said, just walk in the nearby pharmacy. The drug is always there. Muchas gracias. See you in the next video, and do not forget to hit the notification bell, turn it on for more videos that we'll post.